Hepatocellular adenoma is a large benign hepatic tumor. Sometimes it arises spontaneously or sometimes it may be associated with oral contraceptive. But it has been noticed that it usually associated with oral contraceptive quite a lot. It's also associated with anabolic steroids use. So those who are taking those who are on anabolic steroid, this hepatic adenoma likely to occur. Usually seen that glycogen storage diseases, especially type 1, is also associated with hepatic adenomas. As it is a vascular lesion and composed of primary of hepatocytes, and it has tendency to accumulate fat and glycogen within it. There is no portal tracts or bile duct present within the lesion, and there is no bilirubin excretion. Although Kupffer cells are also absent, Kupffer cell activity can only be seen up to 20% in adenomas. Hepatic adenoma demonstrate fibrous pseudocapsule and a central scar like focal nodular hyperplasia, and there is tendency to outgrow its blood supply, resulting in hemorrhage. So there is likely chance of hemorrhage, thrombosis and necrosis. This is what the complication of hepatic adenoma. As far as its clinical presentations are concerned, usually it is asymptomatic. Sometimes it can be painful, or the third very important clinical presentation, it may give rise to life-threatening hemorrhage. So keeping this feature in view, it is usually surgical options are adopted rather than giving them some conservative treatment. So therefore, because there is a chance of having life-threatening hemorrhage in hepatic adenomas. Multiple radiological imaging can be offered to detect hepatic adenoma. The topmost is ultrasound. On the ultrasound imaging, you can appreciate either isoequic or hypoequic lesion. This is transabdominal scan and indicated by the white arrow, and measurement also been taken, and you can appreciate the cursor as well. This is to some extent isoequic lesion, and it is larger than the normal. It is usually seen in the left lobe of the liver. So this is an example of hepatic adenoma. Hepatic adenoma can be either isoequic or can be hyperequic, so it may appear in both patterns, and beside this there may likely be central scarring. However, scar is not visible in this image, but there is likely chance of scarring in the hepatic adenomas. Have a look. This is another transabdominal scan, and on this transabdominal scan you can appreciate two well-defined hypoequic, rather slightly isoequic lesions setting within the right lobe of the liver. These are two in number, round in shape, slightly isoequic pattern. So if you do not concentrate, it's likely that you may miss this lesion. However, central scar is not visible in this image. It's a homogeneously isoequic, a homogeneously slightly hypoequic lesion with round wall. These are two confluent nodules. If you see, like, they are sharing the boundary with each other, and there is no central scarring, there is no cystic degenerative changes seen, there is no calcification in it, and so far the surrounding vasculature is concerned, which is not visible on this image clearly. If it would have visible, it would definitely be displaced because of the mass effect of these two large hepatic adenomas. This is another transabdominal scan showing hepatocellular adenoma, and so far characteristic of hepatocellular adenoma on the ultrasound is concerned, it happens to be either isoequic or hypoequic. This lesion is particularly hypoequic, and with a round mass setting in the right lobe and just adjacent to the capsular region. So this is another example of hepatic adenoma. However, in this image you cannot appreciate central scarring. Central scar occurs when there is large nodule in the large adenoma. You may be able to look for the appreciate central scarring on ultrasound imaging. On this image you cannot appreciate the scarring. However, this is hypoequic, well defined round lesion setting in the right lobe of the liver. Now this is another example of hepatocellular adenoma, and this is the right lobe of the liver, this is the left lobe of the liver. This is the transabdominal scan, and on this transabdominal scan you can appreciate hyperechoic well-defined round lesion along the capsular region. So this is again hepatic adenoma. As I mentioned that on the sonographic imaging there is likely possibility that you may have this image or this lesion as an either hypoechoic, sometime it will appear as hypoechoic and hyperechoic as well. So three characteristics can be seen in hepatic adenoma. As far as this lesion is concerned, you can see that this is a well-defined round lesion with increased echogenicity. This is termed as hyperechoic lesion in the left lobe of the liver. Another example of the hepatic adenoma and echogenic hepatic adenoma. Look for this image. This is a small size up to 2 centimeter lesion setting in the right lobe of the liver. Surrounding liver parenchyma is normal. There is no fatty infiltration or there is no hepatic steatosis. That's why this echogenic lesion is quite visible and you can easily appreciate that. Another important thing is, at first in a glance, if you see this image, so you will definitely jump to the conclusion of hemangioma. So this is not hemangioma, this is hepatic adenoma, because on serial imaging, on CT scan, scintigraphy and other investigation, it has been picked as an adenoma. This is not hemangioma. This is a CT scan, CT axial image. It shows liver within the view and also bony structures available. Liver parenchyma is normal, but a well-defined hypodense lesion setting in the right lobe and along the peripheral margins and the capsular region. This is what the appearance of the hepatic adenoma on the CT scan. Look for the margins. You can appreciate there is a well-defined round margins. Slightly projection can be seen in the downward towards the lower part of the liver, but this is hepatic adenoma, and hepatic adenoma will appear in this fashion on the CT images. This is another CT axial image, and here there is a adenoma as well, but it's a bit tricky, you know. If it can be easily missed, you have to pay attention on and look for, because this is non-enhanced non-contrast enhanced CT, so that's why there is no contrast given or there is no uptake there. So this is a simple plain CT. On this plain CT you can appreciate that the right lobe show hypodensity, and this hypodensity is because of this adenoma. So adenoma appears to be hypodense on the CT axial image, although its upper margins are not very well defined and very well clear, but in the center you can see slightly hyperdense area as well, which indicating that there is possibility of central scarring. So this is hepatic adenoma. Well, another tricky CT scan. Here you can also appreciate two small hypodense lesions sitting in the right lobe of the liver. Other vasculatures are clearly visible. Liver is normal otherwise. Spleen can also be seen in view. Other parts of the organs can also be seen. Abdominal areas are visible on this axial CT imaging. So these are two small hypodense lesion within the right lobe of the liver. So this is also an hepatic adenoma. Well, a clear picture has been shown on this CT axial images. This is a post contrast CT, and on this post contrast axial image shows a normal liver, and there is a small, rather I would say three well defined hyperdense lesion with contrast uptake, and having one of them having a central scar as well. So this is what characteristic adenoma, hepatic adenoma. So you can appreciate these are three well defined hyperdense lesions, one of them having a central hypodense area indicating that there is central scarring. So this is hepatic adenoma, and you know in the differential it will include hemangioma, it will also include hepatocellular carcinoma, and it will also include as hepatic adenoma, which it is actually hepatic adenoma. So hepatic adenoma will appear like this on post contrast CT. On this CT axial image post contrast images, I am sure that you will not miss this large lesion occupying entire right lobe of the liver. Some of the parenchyma of the liver can also be seen there, but this is a large lesion sitting within the right lobe, almost occupying the right lobe. Margins of the liver, margins of the lesion is smooth, rounded, and contrast has been taken. So far the central scarring is concerned, you can appreciate central scarring with high uptake of contrast because of its vasculature, because of central vascularity, and this is why this lesion is called as or known bit difficult, because of the fact that it has life threatening risk. So life threatening hemorrhage risk is because of this vasculature. Here you can appreciate that contrast has been picked up by this central vascularity, and this is hepatic adenoma. Scintigraphy can also be used to pick and differentiate different type of lesions within the liver. There are multiple scintigraphic or radioisotopes are available for the hepatic adenoma. You can use the sulphur colloid, and you can also use the HIDA scan and DSA as well. So far this sulphur colloid is concerned. On sulphur colloid adenoma, hepatocellular adenoma will shows a reduced activity. So hepatic adenoma having a reduced activity on the sulphur colloid scan. Another scanning technique which is available here is a HIDA scan. HIDA scan is stand for hepatobiliary immunodiacetic acid. So immunodiacetic acid can be used to detect this focal nodular hyperplasia. So uptake within the lesion, so you will see there will be uptake in the lesion, but there will be no excretion. Why there will be no excretion? Because of the absence of the bile duct. Bile duct would be absent, so therefore there will be no excretion, but the uptake will be increased. Hepatobiliary or HIDA scan can be used for the cholangio. It's actually called as a cholangioscintigraphy. If there is any problem with the hepatobiliary scanning, so the ideal scintigraphy is HIDA scan, and HIDA scan will help you to pick the point on the scintigraphy for the lesion. On DSA, this lesion will appear hypervascular because it is hypervascular, and that's why there is risk of life-threatening hemorrhage. So on DSA it will appear hypervascular. Some very important point to be noted here, that the large lesion are resected because of the bleeding risk, so therefore you need to take surgical measure. And another important thing is to opting for the surgical measurement is 1% risk of malignancy. So that's why instead of opting conservative treatment, it is best to take the liver out, take the lesion out surgically because of the chance of 1% risk of malignancy. Another condition is called as liver adenomatosis, when there are multiple progressive systemic adenomas that was considered as liver adenomatosis, and there will be no relation with the steroid intake. Another thing, correlation of the liver adenomatosis is that there is a great risk of liver dysfunctioning. So the liver function would be deranged. This is one complication of the liver adenomatosis. The second is there is a chance of hemorrhage, as adenoma or adenoma happens to be highly vascular, so there will be chance of hemorrhage. And the third thing is there is likely possibility of development of the HCC. So these are the three risk factors. So three important points should always be kept in mind in case of hepatocellular adenoma.